You don't have to wait until September. I will tell you exactly why there has been a increase in autism in the United States and what the government can do about it. If you don't know me already, my name is John. I talk about kids' brains. I'm talking about how the HHS secretary is saying they're going to find the reason for autism and what we can do about it to prevent it in September. Number one, that's not how research works. This is not like a we can do this in 6 months thing. Like that, maybe you'll know some more information by like September 2028. But the thing is, we don't actually have to know anything more than we already know. This is the rates. Like, this is the increase that everybody's talking about. And that 1 in 36 number at the very top is now 1 in 32. So is this being caused by external environmental factors? Yes, absolutely. Can the government do something about the external environmental factors that have caused this increase? Yes, absolutely. But it's not what you think. It starts with understanding that the reason that people go out and seek a diagnosis for autism, most likely, is 3 things. 1, so that they can actually get the health care from their private insurance that they need for their child. Because we live in a system that is run by insurance companies, we do not get the health care that we need for our children. In order to get that health care, in order to get those accommodations, we need to get a diagnosis on the record. It has to be recorded so that we can get the basic services that we need. That means it is in the interest of healthcare providers to broaden the definition of autism as broad as they can make it, so that the most people who need those services can get access to those services. If you did not require such a diagnosis, if we lived in a single payer system where people could just get access to the resources and help that they need, you probably would not see as great of an increase in these rates. Thing number 2, we also have a huge problem in public education. Namely, that the Prussian system of education, of which the United States system is built upon, is all about systematizing and standardizing the education process. What is glaringly obvious to educators who do any sort of research into how people learn is that this is a terrible way to educate anyone. And that most people, most kids especially, are going to thrive much better in a personalized, individualized type of environment. The type of educational structure, in other words, that you can get with a diagnosis. So as we push standards forward and forward and forward, and we force kids into a model that does not work with them, but works against them, more kids are going to fall outside of that norm. And when they fall outside of that norm, parents are going to go seeking diagnosis to explain why that is. That is an environmental factor. And the more kids feel like there's something wrong with them or that they're abnormal in some way, the more they are going to live into that self-fulfilling prophecy in some ways. So what I want you to understand is that this is not a sign that there are more autistic people. This is a sign that, number 1, we have a healthcare system that is built upon the back of formal diagnosis. Number 2, we have a school system which fundamentally works against the way that kids learn and requires diagnosis so that they can get the accommodations that they need to just achieve at a normal level. And number 3, as these things happen, people become more aware of the existence of autism, and so they are going to go and get tested more. And that reason is how you go from 1 in 10,000 to, 1 in 150. That increase had nothing to do with the factors that I was just talking about. That increase, according to everyone with a brain, is just because we didn't really know that it existed, and so we just weren't diagnosing for it. So is ASD a real thing? Absolutely. Is it good that we're broadening the categories so that people can get the individualized care that they need? Absolutely. But this is what happens when that happens. So if the government wants to do something about reducing the rate that's now 1 in 32 kids, what you should do is pass universal healthcare, number 1. Number 2, reform the education system. Don't delete the Department of Education, which, by the way, is doing a lot of this accommodation that's even allowing for the education system to flourish at all. But reform the education system that works with kids' brains. By the way, this is my next book, if you're interested. And create an educational environment where a kid can receive personalized care, even if they are maybe not getting a formal diagnosis. And number 3, stop chasing ridiculous fairy tale answers to this question. It's not fluoride. It's not vaccines. Like, this is from capitalism.